The tongue inspection is a diagnostic method to understand the physiologic and pathologic condition of the human body through observing the tongue manifestation, which including two aspects: the tongue body, or called tongue texture, which composed of muscles and viscera. Second, the tongue coating, which refers to the lint-like material on the top surface of the tongue. The tongue inspection is one of the most unique diagnostic methods in Chinese medicine. And why the tongue is so important? Why the tongue can tell so many inner questions? As in the chart shown in here, the zangfu organs are all related to the tongue through the channels and the clitoris. The tongue is the sport of the heart. The heart governs the blood vessel, so the heart blood nourishes the tongue. The spleen and kidney meridians reaches the bottom of the tongue. In addition, the tongue coating is formed by qi and the fluid of the stomach. The liver connects with the tongue body. Lung characteristics reach up to the larynx and pharynx, link with the tongue root. Obviously, all zangfu organs are connected with the tongue. Based on those theories above, we can come to a conclusion. Tongue has a closely relationship with the zangfu organs and qi, blood, and fluids. The tongue manifestation is a window to internal changes. It has proved in clinical practice that the condition of constitution, abundance, or deficiency of healthy qi, the nature of an illness, and the progress can be objectively reflected on the tongue. So the tongue manifestation is a very important clue of diagnosis for practitioners. According to the theories mentioned above, the reflection of each organ has different classification on the tongue. Check the picture 1. The tongue tip corresponding to the heart and the lung. Middle part refers to the spleen and stomach. Root refers to kidney, and the liver and gallbladder are corresponding to the tongue edge. In picture 2, the tongue coating, normally classified by the stomach meridian into 3 parts: up, middle, and lower. The index, which tell the excess and deficiency of inner qi, blood situation of the tongue, are based on 5 aspects: the tongue vitality, we call it shen, tongue color, tongue shape, and the tongue motility. The tongue coating are judged by coating color and coating texture. The method of tongue inspection should focus on those tips. First, tongue posture. The tongue body should stick out naturally, relax, and expose sufficiently. Second, the order of inspection should be from the tongue top to the middle part, then tongue egg, and tongue root. 3. The sense of taste and feeling also should be asked. Meanwhile, it is essential to exclude some factors that may cause false information, like the quality and brightness of light has a great impact on the color of the tongue. So the best time for observing is in the daytime. Sufficient and soft natural light is optimal. The food and drug also may alter the tongue, like the long time taking of some antibiotics may result in rodent curdy coating. The last precaution is the oral cavity. Like the impaired teeth may thicken the tongue coating of the same side. Artificial teeth may cause tooth prints on the tongue edge. So we come to a question: what is the normal and healthy tongue? The characteristics of the normal tongue manifestation is a soft and flexible, suitable sized tongue with pink color and a thin white fur. The sublingual veins are all in normal color and shape. In brief, It is a light red tongue with a thin white coating, which indicates the genital organs functions where the shen, the blood, and the body fluids are all abundant and stomach qi is sufficient. On the contrary, what are the pathologic variations of tongue? Mostly, it was judged by the color and shape and motility. Let's talk the tongue color first. We take the normal color, the light red as the central point. The abnormal tongue colors can divide it into two directions. Turn left, hypofunction, like qi, blood or yang, or deficiency. The color in face, tongue, lips is easily manifested as pale. The right side, in hyperfunction situation, the color is manifested like red, which is caused by heat speeding the blood circulation. It is a general index for heat syndrome. If the red color becomes deep red, like the crimson, that indicates severe heat, like the excessive heat syndrome or warm heat disease. The last color, blue-purple, mainly indicates impaired flow of blood, which can be caused by excessive heat or excessive internal cold. It's often seen in disease of liver and heart problem. The tongue shape, including characteristics such as toughness and tenderness, size change of being enlarged or thin, have spots, cracks, tooth marks, etc. The tough and tender can distinguish the excess from deficiency syndrome. The small and thin tongue indicates deficiency of qi and blood or insufficiency, while the enlarged tongue indicates retention of water and dampness. The cracks or fissures on the surface of the tongue usually indicate injury of body fluids due to heat or fire due to deficiency. The tooth marks easily found at the edges of enlarged tongue, which indicates deficiency in the spleen and excessive water dampness. The last one, sparked and pricked tongue, usually suggests yang heat in the genital organs or excessive heat in blood level. The motility of tongue focuses on those 6 types: the flaccid tongue, stiff tongue, trembling tongue, deviated tongue, shortened tongue, or protruding and moving tongue. Each of them has typical clinical significance. Like the deviated tongue, is often found in the stroke situation or before stroke. After the tongue body, let's talk the tongue coating. The one refers to the lynch-like material on the surface of the tongue, which is produced by the upward stream of stomach qi and upward flow of stomach fluid. The tongue coating of a healthy person is evenly thin, white, moderately moistened. Pathologic tongue coating is the manifestation of pathogenic qi fighting with stomach qi. Inspection of the tongue coating includes the observation of the color and the texture. The tongue color generally has 3 types: white, yellow, and grayish black, which can occur alone or simultaneously. White color is the normal color of tongue coating, but in patients, it can be found in the exterior syndrome, cold syndrome, and dampness syndrome. The yellow coating can be lightly yellow, deep yellow, and scorched yellow, which indicates a heat or interior syndrome. The different yellow refers to different levels of heat. The last one, grayish black coating, it includes the gray color, grayish black, and black. That indicates severe heat or cold syndrome. The difference is the surface of the tongue coating is moist or dry. The texture of tongue coating means the quality and form of the tongue coating. Inspecting tongue coating texture including observing those aspects: thick or thin, moist or dry, greasy or curd-like, peeled or not. The thick coating refers to a thin layers of coating through which the tongue body is vaguely visible, while the thick one means we can hardly see the tongue body through coating. The clinical significance of thick or thin coating mainly reflects the excess or deficiency of healthy qi and pathogenic qi, and its location. The moist or dry mainly reflects the body fluids it's experienced or consumed, and the greasy or curd-like coating. Here should pay attention to the difference. The greasy one is thick in the middle and hard to scrape off, while the curd-like coating is loose in texture and easily to scrape off. They all indicate the phlegm retention or accumulation of dampness of food. The bearded coating, manifested as the interior or part of the coating is peeled off, and the peeled area is smooth without coating. It indicates shortage of stomach qi, exhaustion of stomach yin or deficiency of blood and qi. Here you can see some tongue pictures. Those are the typical selection which reflect the representative disease or syndromes, but it not the whole expression of tongue. Cause time is limited, we only can do this brief introduction. Hope you mastered the essence. That's all for today. See you in the next chapter.